It's 10 minutes after 7 o'clock, and as the surge of COVID-19 continues here in Arkansas, we wanted to get an update from the medical side of the pandemic as we welcome Dr. Steppe Mette, the CEO at UAMS. And, Doctor, welcome back to the show. How are you doing this morning?
I'm fine. Thanks, Toby. How are you?
Very good, thank you. And Doctor, first off, how is your hospital looking as of this morning in terms of COVID cases and ICU bed availability? Are things still strained at this point?
Yes, they're strained, but we do have some capacity. We have a few fewer patients with COVID in-house this morning than we did yesterday or the last few days. So that's heartening. We certainly have the ability to take care of more patients.
And same thing, but on the staffing side, how are things looking on the staffing front as far as, do you have enough people to cover all the patients that you currently have in the hospital? I know I've heard, in the last week or so, it seems like I've heard stories specifically out of UAMS about some nursing shortages, or at least a lot of openings for potential nurses to take jobs.
Yes, so there has been a staffing shortage, especially a nursing shortage, but also respiratory therapists and patient care technicians in the state for quite a while that predated COVID. But the demand for inpatient care has really strained and underscored that shortage. So we are seeing a staffing shortage throughout the whole health system in the state, certainly at UAMS as well. We have sufficient staff to take care of the patients today, but as has been reported over the last several weeks, our nurses, our doctors, our technicians, our therapists are fatigued. They're tired. They're weary because of the duration of COVID. But we can and will take care of any patient that comes to UAMS.
Well, and that's obviously good news, at least as far as the patients are concerned. So we're talking with Dr. Steppe Mette, the CEO at UAMS this morning. And obviously school started this week, Doctor. And so that brings up a lot about the Delta variant. And obviously it's attacking, these younger age groups. And so I guess, one of my big questions is what is different about the Delta variant that makes it attack the younger age group, more so than the original coronavirus?
Well, it's a great question. I think that the jury may be out still to explain it all, but certainly one factor is the relative lower numbers of vaccinated individuals. The younger age groups are less vaccinated as a percentage than the older age groups. Some of that has to do with the availability of the vaccine initially to older individuals in our society. And, of course, those under 12 don't even have access to the vaccine. So I think that is the number one factor.
And obviously another big item that's come up, with the special session at Congress and with the different school boards is about the masks. And Doctor, I'll be honest with you, I've definitely been one that's had questions about the mask, and I do, I'm respectful with it. I wear it where I'm supposed to, but especially when we talk about masking for vaccinated people, and mainly because just looking at the big picture, it doesn't seem like the mask has necessarily stopped anything at this point. We've been doing masks for a long time now. We're into a big surge once again of the pandemic. And so can you talk a little bit about the science of the mask and why you believe that masking is important?
Yeah, I actually think that masking is a primary strategy to help the slow down the spread of COVID. So I don't think there's anything that refutes the fact that masking works. What looks like lack of effectiveness may well be, and I believe, is due to the relative low compliance with using masking in the public. And that's, when we had our direction from the CDC in the spring that we could stop wearing masks, I think that fueled a lot of the glee in not having to wear a mask, but probably was a premature recommendation. So it remains an important strategy. Nothing is foolproof, but I would say that both in vaccinated and certainly in unvaccinated individuals, masking is a primary strategy. It is known to be effective, and I would continue to urge people to wear a mask when in public. We certainly continue to have a masking mandate here at UAMS, and I wear a mask. I'm vaccinated. I wear a mask wherever I go in public for the same reason.
We're talking with Dr. Steppe Mette. He's the CEO of UAMS this morning. And Doctor, do you expect the caseload to get bigger as we get into the fall months, into the colder parts of the year? Because, we all, at least in the past, we'd heard, the summer months, maybe it won't be as bad, but obviously we're in the middle of a big surge here in August. But do you expect the colder months to even get worse?
Well, that is everybody's concern, and those are the projections indeed. The hope is that the current Delta variant-related surge will peak in the early to mid-fall. But it is known that coronaviruses tend to like the colder weather, that when we are more grouped inside, there's the greater risk of spread. So, yes, I think there is the concern, maybe even the expectation that the numbers will increase, hopefully not at the same rate, and hopefully we will see a decline in the Delta variant over the next several weeks or months. Of course, as you stated, with our children and young adults being in school, we'll have to pay close attention that we don't see the surge.
And another question that's definitely come up in the is in fact even today is one of the top stories is about the idea of getting booster shots for everyone. And so can you explain a little bit about the data and what you're seeing that shows why we need to get booster shots, especially for those that have already had the first two?
Yeah, I think there are a couple pieces of data that are driving that discussion. One is the experience in Israel, where they have about 80% of the population vaccinated, and they're seeing significant breakthroughs in that vaccinated group. Now, that does not necessarily translate into getting sick and being hospitalized, but there is that concern if there are breakthrough infections, one can spread it. That's the first thing. The second is that there are some laboratory data to suggest, generated here in the United States, that the amount of antibody produced in response to the vaccination starts to wear off. I don't think that everybody agrees that everybody needs to get a third dose. There is considerable disagreement about that in the scientific community, but I think we all need to pay attention to what our public health officials will end up recommending. And I believe that the federal CDC and our federal government officials will be coming to agreement on how to recommend a third dose. I suspect we'll see that recommendation come out.
Yeah, well, and it sounds like it may even come out later today at this point from what we're seeing in some of the news this morning. Doctor, I like to, when I get someone like yourself onto the show, I like to maybe ask you a question about a conspiracy theory that, that we hear. A lot of them I've heard here on our radio station in different parts of the day. And so one of the things that I've heard several times is people who don't really necessarily take the virus that seriously. And they say things like that the hospital gets paid for COVID patients, and that's why a hospital would inflate numbers of COVID patients. And so I have a couple of questions for you on this. And so one is that even possible to coordinate with all your doctors, and when you think about it even on a nationwide basis, to coordinate that with everybody to be doctoring numbers, no pun intended? And then two, do you make more money from doing elective surgeries on a daily basis compared to what you might get in a government COVID reimbursement?
Yeah, so it's a great question. It is impossible for the kind of coordination required, that kind of collusion to create that accusation of conspiracy. So it's really impossible. There are specific criteria that define whether an illness is related to COVID or not, and those are demonstrable, they're reproducible, they're transparent. We know when somebody has COVID, when somebody doesn't. And I do not know of any healthcare organization, hospital, health system that financially benefits from the care of COVID patients. Quite the opposite. We do this because we take care of anybody that is ill and requires our care. There's no special payment for COVID illness. So it's just a false rumor. Doesn't hold any water at all.
Well, and I appreciate you speaking to it this morning. It's definitely something that we hear and we see it in social media. We see it online. We see all sorts of different things. So I appreciate you taking that question this morning. But Doctor, I appreciate you coming on the show and giving us your insight this morning. We'll of course do it again very soon. But have a good rest of your Wednesday.
You as well, Toby. Thanks so much.
All right, there's Dr. Steppe Mette, the CEO at UAMS. We